for a drug to absorb, what it should have? It should cross a membrane, or it should enter from whatever route it has been administered into systemic circulation. So for this to happen, first and foremost, as I said, cell membrane, a barrier, it has to be crossed. Consider this is the cell membrane. It is lipid bilayer. Polar ends are arranged outside, hydrophobic ends are arranged inside. It contains various channels, for example aqueous channel, and it may be having carrier protein. This will be the intracellular side and opposite side will be extracellular side. Consider this is one more cell, and in between two cells what will be there? Intercellular junction, or it is known as paracellular space. Okay. Now consider this is drug. A drug has to cross this membrane. It can cross in various ways. We'll see. First way is it can simply diffuse. This is known as diffusion through lipid, or it is also known as passive diffusion. For this foremost criteria is drugs should be lipid soluble. Only lipid soluble drugs can cross membrane, diffuse through membrane like this. Okay. Or a drug can pass through aqueous channel, enter into the cell. This is known as also known as filtration or passing through aqueous channel. Or a drug can enter through a carrier protein. This can be active process or a passive process. This is known as carrier mediated transport. This is a specialized drug transport. Or a drug can, for example, a drug can have some adhering molecules here. Drug can get adhered to these. This happens usually for larger. I have drawn it larger. Okay. Now this will get inside the cell in the form of vesicle and gets extruded. Drug will come inside. So this is what you all know. It is endocytosis. Exocytosis can also occur, including both is known as vesicular transport. So these are the four ways by which drug can cross a cell membrane. So among these four, the most important one is this diffusion through lipid. This is the most important route, and it has been our most important route for transfer of drug is diffusion. Next most important is carrier mediated transport. Okay, it is next one. So remaining two through aqueous channel. This is not important. Why? Because only drugs with molecular weight less than 100 daltons will cross through this membrane. Most drugs have molecular weight in between 100 to 1000. So very few drugs will enter cross cell membrane through aqueous channel. And vesicular transport, it is also least important. It is usually for larger molecules. For example, vitamin B12 may be crossing through membrane through this. Okay. So if the drug is not lipid soluble, drug has a molecular weight more than 100, and there is no carrier protein for it, and there is no vesicular mechanism also. How the drug can transfer? Some large molecules which are lipid insoluble can enter into systemic circulation through paracellular spaces. This is usually by IM or subcutaneous route. Drugs will enter into blood vessels through this route. Okay.